Hi, I'm Dr. John Young with Foundational Health Center here in Largo, Florida. And today I'm going to give a little bit of a history lesson of how I got involved in this whole area of brain injury, near drowning kids who've ended up with brain injury, just conditions that I am seeing more and more of in my practice. And I want to give you a little history though, a little bit about me and how I kind of ended up where I am today. Back when I started medical school, I actually wrote in my essay that I wanted to get into medicine to get people better. And it was during my residency, I was about 8 months into my residency, and working at the government hospital there in Huntington, West Virginia. And I noticed after a while that we just did the same old things for these Army veterans. You didn't deviate from the protocol, and we'd get them feeling better. They'd go home for 6 weeks, come back for 2 weeks, home for 6 weeks, back for 2 weeks. And I said to my senior resident, and I said, listen, why don't we do something really wild? Why don't we try to get these people better? And he looked at me and said, John, you want to finish your residency? I said, yes. Then you shut your mouth and do what everybody else does, and you'll be fine. So I zipped my mouth closed, threw the key away, and I got through my residency training. So as I'm practicing medicine, and I'm seeing all types of problems, but with these neurological injuries, I just got very depressed in treating them, because really it was, we can take care of the acute emergency, which I did when I was an ER doc, and then basically stabilize them and maybe give them a little physical therapy, maybe get the parents in a support group, and that was about it. And a lot of things changed for me February the 1st, 2011. And that's when my daughter was born, Catherine, and she was born with Down syndrome. And we went to the big medical institution here in our area, and they're affiliated with a big hospital that's well known throughout the US. And they told us, well, Catherine has Downs, or do all these little tests, but she basically has Downs. She's going to be sick all the time. So if you call, she'll be seen that day. She'll be on antibiotics most of her life. And we can get you into a parent support group, get her good physical therapy, all things like that. And Carmen and I went home, my wife, and we talked, and we said, that's fine. That is perfectly fine for a lot of people. It wasn't fine for us. And maybe we're just a little weird. And so we said, what can we do to not just maintain her, but actually get her better? So we looked at a number of therapies, a number of supplements and things like that. And we just started out on our own. One of the first things we did was we put her on high doses of vitamin D, because we had learned that every single cell in your body, especially in the brain, has a vitamin D receptor. Vitamin D is vitally important in how the mitochondria in the cells make energy. It's important for the immune system. And so we put her on large doses of vitamin D. And I was thinking the other day, let's see, she's 10 years old. Oh yeah, she's never been on antibiotics. We are told she's going to always be on antibiotics, never been on antibiotics. Then we started looking at some ways to get this brain to start working. And there's some interesting studies out there with using a form of thiamine, and we started using that form, allotheanine. And we've seen in a number of cases with this form of thiamine how seizures have really started to mitigate themselves, reduce themselves. how there's been great changes in the brain structure for the better. So L-theanine has been very good in using it on these brain injury patients. The other thing that I did a lot of studying with is we looked at Enbrel. And for those of you that are not familiar with Enbrel, E-N-B-R-E-L, it's a drug that they use for psoriatic arthritis. I have a number of patients on it, young kids, older people. And for psoriatic arthritis, you get a shot of it every week and it controls it. People are happy and things are going on well. Long-term use of Enbrel for psoriatic arthritis, getting it every week, does seem to cause a depression in the immune system, and later on in life there can be some other problems. But in this study, it was done just to give to the patient a couple times. Never really been done in young kids under 13, but I had a number of kids who are 2 years old, 5 years old, 6-year-old, whatever. Because the thing to remember this, anytime you have a brain injury, whether it's cerebral palsy, Downs, near drowning with anoxia brain injury, genetic problems, post-traumatic stress disorder, depression, all the brains are inflamed. It's just kind of a chronic aspect to this. And so there's a way to get Enbrel in past the blood-brain barrier into the brain itself, and it works extremely fast in stopping the inflammatory cycle. And the way you do it is you actually access the vertebral vascular system. Very few doctors know how to access that system, even though it's been in the textbooks since the 1650s. The Polish doctor, anatomist, discovered it, and I probably use that system 3 or 4 times a week with my patients. So we don't have to do anything like a spinal tap or anything like that. And I used it on my daughter. And my daughter was classified as, very poor educational possibilities, just poorly, just brain-wise, she was not very strong. So we gave it to her. I will tell you, it was about 10 minutes after we gave it to her that I came back and she started talking, and it was like, whoa. First of all, very clear enunciation, very clear, which she hadn't had before. The other thing is, we noticed, and the teachers actually told us, I don't know, but all of a sudden, Catherine has great educatable potential. Memorizing everything. And for parents, that can be good or bad, because she says, Daddy, remember you said don't do this, and you did it, and whatever. But completely has changed her. And all we really did was stop the inflammatory cycle within the central nervous system. And it's been really exciting to see her change. And that was over a year ago. But also I started doing with my autistics, my near drowning patients, my cerebral palsy patients, patients with other genetic central nervous system disorders. And it's not 100%, it's about a 70 to 80% success rate. But it really has been successful in that it really gives a big jump, and it's fairly quick. It's usually within the first 24 to 48 hours, if it's going to work. And Enbrel has really made a big difference in how we treat these brain injured people, these children. The other thing is, I've started using more Piracetam. And Piracetam, if you're in Europe, it's considered a drug. If you're in the US, it's considered a nutraceutical. What it does is it organizes the electrical system between the right and the left hemispheres of the brain, and really works in the area of the Broca area of speech in the back of the brain. So for a lot of my kids who are slow to speak, even have trouble speaking at all, I've used this because it helps organize those electrical connections in that whole speaking pathway. It's not like Vertebral, they're very quick and whatever, but it does over time seem to make a big difference in their ability to speak. And that has made a huge difference with a lot of my patients the kids don't speak, and to be able to communicate with your kid and actually have a conversation is a wonderful thing. And I think it's important that patients or that the family realize that, listen, there are a lot of cheap and easy things you can do to make your child better. We've also used exosomes. We use some other blood products to help develop the brain and develop areas in the brain that are damaged and whatever. But this is just a little quick talk to let or encourage people who've been told, basically there's nothing else to do. Good luck. Here's a therapy group. Get some physical therapy support group for their parents. That if you can go outside the box of the medical establishment and look at other protocols, you may be very greatly surprised. So enjoyed talking to you. I hope this has gotten you encouraged. And give us a call, email us, and hope to see you soon.